It's 2 a.m., and the wet, repetitive sound of your dog aggressively chewing its paws is echoing through the room. You've sprayed the area with bitter apple deterrent, and it is completely ignored. Veterinarians hear this specific complaint almost every day. It ranks as one of the most common issues in small animal practice, and paradoxically, one of the most frequently misdiagnosed by pet owners. The core disconnect happens right at the start. Owners treat chronic paw licking as a behavioral flaw, a bad habit to be trained away. In reality, it is almost always a strict physical symptom. Clinical professionals run symptoms through a diagnostic funnel, sorting chaotic observations into 3 categories: allergies, injuries, and anxiety. It relies on 3 filtering variables. First, the quantity of paws affected. Second, the chronology of the behavior. And third, the physical condition of the skin. Attempting to correct the behavior without pushing it through this specific filter is a waste of time. You cannot train away a medical issue. Allergies are the primary driver, accounting for 55 to 60% of excessive licking cases. The webbing between a dog's toes is highly absorbent, acting like a sponge for microscopic irritants. This comparison chart contrasts the 2 main allergic triggers. On the left, we have environmental allergies. These are highly seasonal, typically target the front paws, and spike immediately after a walk outside through pollen or grass. On the right are food allergies. These present consistently year-round, regardless of the weather. They also frequently arrive paired with digestive distress and recurring ear infections. Chronic allergic licking leaves a biological signature written directly on the dog's foot. The fur between the toes will shift from its natural color to a distinct rusty brown. That discoloration is a microscopic chemical reaction. Dog saliva contains porphyrin compounds. When saliva repeatedly coats the fur, those compounds oxidize upon contact with oxygen, literally rusting the hair. Then there is the odor, a distinct corn chip smell that occurs when trapped saliva and body heat create the perfect damp environment for Malassezia yeast. Topical bitter sprays fail here because they do not break the self-perpetuating loop of allergens, saliva, yeast, and inflammation. The second major culprit sits hidden beneath the fur. Acute physical injuries account for roughly 25 to 30% of cases. The actual behavior typically looks like this. The dog suddenly stops during a walk, lifts a single paw, and obsessively focuses all its attention on that one isolated spot. The pattern of an injury is distinct from an allergy. It has a sudden onset, it has 0 correlation to the season or diet, and the licking is strictly localized to one foot. The hazards driving this behavior are usually invisible from a standing distance. They include hairline pad cracks, chemical burns from hot summer asphalt, or deep interdigital cysts forming underneath. Foxtails present a highly specific, hidden danger. These barbed grass seeds easily lodge inside the webbing and are designed to physically migrate deeper into the tissue with every step the dog takes. Feeding your dog a new diet or administering antihistamines will never solve the problem if there is a piece of glass embedded in their foot. The final 10 to 15% of cases involve true behavioral and anxiety-driven licking, typically triggered by separation or distinct phobias. This diagram illustrates a specific chicken and egg dilemma in veterinary behavioral medicine, a condition formerly known as acral lick dermatitis. Even in cases of true compulsive licking, the cycle almost always begins with a minor physical trigger that prompts the dog's initial scratching. The physical act of licking releases soothing endorphins. This provides a rush of temporary relief that the dog quickly learns to crave. This self-rewarding loop causes a permanent, thickened tissue mass known as a lick granuloma. The dog continues to chew the granuloma long after the initial physical trigger has vanished. Because anxiety loops are born from physical pain, owners must exhaustively rule out physical injuries and allergies before assuming the problem is purely in the dog's head. This flowchart from the American Animal Hospital Association shows how veterinarians strictly codify this diagnostic process. They filter through pathways for ectoparasites, food, and atopy before ever prescribing treatment. This complex clinical logic distills into 3 specific questions. The first, how many paws are affected? If the dog is licking both front paws, the data points heavily toward an allergy. If the focus is entirely on a single paw, it points strongly toward an injury. The second question is, what is the chronological pattern? Seasonal shifts indicate environmental allergies. Year-round consistency suggests a food allergy. A sudden onset right after a walk indicates a foreign object. The final question is, what does the tissue actually look like? Rusty brown stains and a distinct yeast smell confirm a chronic moisture and allergy loop. Visible swelling or localized heat confirms physical trauma. By systematically interpreting the physical evidence their dog leaves behind, owners can stop wasting time on the wrong treatments and finally break the cycle of the itch.